years ago, the first cases of a virus from overseas were reported here in the U.S. The CDC requested emergency authorization for a test to diagnose cases of that virus that we didn't know what it was. The Secretary of Health and Human Services declared a public health emergency.
That virus wasn't even officially called COVID-19 until February 11th.
Well, that's when President Donald Trump officially announced emergency measures to keep the public safe during the COVID-19 pandemic. That was March 13th, and of course, 2020.
Now, almost 3 long years later, President Joe Biden is planning to end those declarations.
But we are still seeing COVID-19 spreading here in the Triad, the state, and all the way across the U.S. The most recent percentage of COVID tests coming back positive in Guilford County, 15.4%. And you can see it's really on par with our latest numbers as well.
The good news, it is well below the numbers the county was reporting back at the end of December when data peaked at about 30%. It's important to point out while our numbers are getting better, they're all above the county's goal of 5%, which is that red line there.
There were 2 emergency orders made, the COVID-19 national emergency and a public health emergency.
So why end them now? Well, the COVID-19 national emergency was actually supposed to expire March 1st, and the public health emergency was scheduled to end April 11th. President Joe Biden's really pushing back those dates to May 15th.
We've extended to May the 15th to make sure we get everything done.
Let's dig into the changes you'll see coming right here in the next few months.
When the public health emergency ends, you're going to have to probably reach into your wallet for a few more things. Insurers will no longer be required to cover the cost of free at-home COVID tests. As for now, you can keep getting your COVID vaccines for free. They're already paid for by the federal government. But when the current vaccine supply runs out, there's no word about what that could mean for people having to pay.
Medicaid enrollment ballooned during the first pandemic, in part because the federal government prohibited states from removing people from the program during the public health emergency. Well, late last year, Congress told states they could start removing ineligible people in April. Millions are expected to lose their coverage, either because they now make too much money to qualify or they have moved. Many of those people are expected to be eligible, though, for low-cost insurance plans through the Affordable Care Act or their employers.
Well, the public health state of emergency has also impacted a lot of non-health related areas. For example, President Joe Biden's student loan payment pause and the plan to forgive student loan debt. The Justice Department previously argued that the Secretary of Education did indeed have the authority to pause those payments and forgive loans during a national emergency because of the HEROES Act. As it stands right now, the payment pause is expected to end 60 days after the public health emergency could be lifted. A Biden administration official says ending the health emergencies will not change the legal argument for student loan debt cancellation.
As COVID began its spread here in the U.S. in March 2020, the emergency declaration allowed border officials to deny people the right to seek asylum. Those restrictions will remain in place when the declaration ends for now. That's due to a pending Supreme Court case. Republican lawmakers sued after the Biden administration moved to end the Title 42 restrictions last year. Title 42 will be active through at least December, pending the Supreme Court's decision.
So you've heard COVID is still out there. What should you be doing to protect yourself now that the emergency orders are going to be ending somewhat close in the future?
Please take advantage of this new bivalent COVID booster that's out there and widely available and continues to be free. We have under-accepted that booster, and it's clearly keeping us out of the hospital. If you're older, if you have an underlying illness of heart disease, lung disease, diabetes, if you're pregnant, if you're immune compromised, those people particularly ought to be careful. Keep using that mask. If you're traveling, yes, use the mask. Going to the supermarket, use the mask. Still observe some social distancing.
Remember, you can still get COVID vaccines for free from your local pharmacy or doctor. Everyone 6 months and older is eligible.
WFMY News 2 at 6 is coming up next.